Children are unique. Children are different than the adults. Children don't speak for themselves. You have to be an advocate for them.
Cal's early work to recognize the specific vulnerabilities and needs of children really set the stage for the transformation of pediatric medicine.
His vision of how to care for our children, and not only here in Hawaii, nationwide, he has that kind of commitment.
For him to have the vision that he did back in the 1960s is, he was 40 years ahead of his time, quite honestly.
When I started practice, I sort of wanted to be a different guy. I sort of wanted to mold a system that would look at programs working together.
I know Dr. Sia as a father of Healthy Start. We have Healthy Start workers that go into the home and basically support mom, dad, and the whole family in taking care of the child.
A child is born innocent, whether the parents have wealth or don't have wealth. What's the opportunity for that child? Great, with supportive services.
I don't know that I've ever met a person who gets stuff done as effectively as Cal by having others do the work with him.
So I looked at the community, and that's how I started Child Protective Services, Prevent Child Abuse, Home Visiting, to bring in community support to the family and myself to coordinate, communicate, and work together. Then I brought in the first emergency medical services for children and got Senator Inouye to write the bill to cover the whole nation. And we got this through. And all states and territories have emergency medical services for children.
This ability to be disruptive by specifically reaching across boundaries and putting families in the middle as partners in the care. When you frame it that way, it draws people in.
One of the areas in the 60s nobody took care of was the so-called neurologic learning disabilities.
He had seen a need for this segment of the population of children, and he wanted to help them.
I was able to work with the legislature and actually work with Don Ho and the Land Commission, Mihao, and Pinky Thompson, and all the big boys. And we got the land, the acre land at Variety School, and we got the building built.
Whenever he met people, he always meant everything from the bottom of his heart. So you were just engaged with what his mission was, and it became your mission.
Health equity, no matter where you're born, should allow that child to have continuity, comprehensive, compassionate care. That's what I started, and that was my dream.
I feel that Dr. Sia's vision for that so-called medical home, which, as you know, he began to articulate as early as the late 1960s, is still just as relevant today as it ever was.
I think our children are much better off because of his contribution to our community. I think he's taught enough people and has influenced generations of folks that I feel his presence will always be with us.
If he gave me any advice, it would be, as long as you can be caring and you enjoy what you do, I think that will kind of reflect into becoming the person or the pediatrician that you wanted to be.